Good evening, everyone. My name is Chris Verger. Welcome to the channel. In tonight's talk, I'll be speaking to Naomi Bauer, a physiotherapist based in Scotland. Naomi is also a long hauler, but has experience treating those with long COVID, POTS, and dysautonomia. Welcome, Naomi.
Thank you. Happy to be here.
It's great to have you here. I'd love for you to start off by just diving into your journey with long COVID so far. Yeah.
So I have had long COVID now for a little over 2 years. I had my first COVID infection um, in January of 2022, actually, my only one, my one and only so far. Um, and ended up developing long COVID shortly thereafter. And it's been it's been a really interesting process for me because I kind of have had a very unique experience in that I was working as a physiotherapist treating long COVID prior to getting long COVID myself. Um, and so when I developed COVID, I kind of already knew a lot of what I should and shouldn't be doing, what to expect, what to look out for, what precautions to take right off the bat, which I think definitely probably helped me recover from the acute illness more easily and um, likely limited the severity of my long COVID compared to if I hadn't known any of those things. I probably would have returned to activity much more quickly, which, as we now know, can be detrimental. So, in that regard, I was very fortunate that I kind of knew not to push myself. I knew a lot of the support things to do early on. So, I was immediately wearing compression, immediately upping my hydration and my electrolytes, immediately doing very gentle movement, but not pushing it, keeping an eye on things like my heart rate and whatnot. But despite that, I did still obviously develop long COVID. Um, and now over the last 2 years, I've been kind of rehabbing myself through it as I work with clients who I'm helping to rehab through long COVID as well. So it has been a very interesting experience from that perspective.
Naomi, what were your acute infection symptoms?
Yeah, so for my acute infection, it was honestly kind of like a bad cold, like a lot of congestion, respiratory cough, fatigue. Um, I don't think I actually ever had a fever. I never lost my taste and smell. I believe I had the Omicron variant, which generally was more mild for the acute infection. Um, but then for my long COVID symptoms, it's been primarily um, fatigue and exercise and activity intolerance, but also with other aspects of dysautonomia. And so there's a lot of different types of dysautonomia. The one that we hear about the most is postural orthostatic tachycardia syndrome, or POTS, and we can get into talking more about exactly what POTS is and the differences there. But dysautonomia is a dysregulation of the autonomic nervous system. And so for me, I experience some of the other symptoms that go along with that. So I do have high heart rates, but not in the same way necessarily that people with POTS do. I get lightheadedness, I get some dizziness and feeling off balance, GI symptoms, fatigue, exercise and exertional intolerance. Um, so kind of a lot of what a lot of people experience. Like I mentioned, I've been very fortunate that my symptoms have overall been fairly mild compared to a lot of people. I never had to completely stop working. I was never housebound or bedbound, but I definitely did have to cut back a lot on what I do. And I still, even 2 years later, have not returned to all of the higher intensity type of activities that I used to do. I used to do quite a bit of running, and I still have not gotten back to running yet, type of thing. And then the other big symptom that I had was a blood clot in my leg about 6 weeks after my COVID infection. Um, and that was something that still not 100% sure if it was fully COVID related. It was more likely just kind of like the perfect storm of a few different things for me of, having recently had COVID, having recently flown on an airplane, um, being on an oral contraceptive, all of those different things that make you more susceptible to blood clotting. And then I later found out that I also have a genetic predisposition to blood clotting. So for me, it was kind of all of these things combined together to make my risk higher. So was it definitively from the COVID? Hard to say. Did the COVID contribute?
Mm.
Most likely.
How did you know that you had this blood clot in your leg?
For me, it was actually kind of a little bit of an atypical presentation. Really, the only symptom that I had was pain. Um, and so prior to getting COVID, I had spent many years working with patients with cardiovascular and pulmonary disorders. And so screening for blood clots is something that I was doing often with my patients. And I knew about the risk factors that I had for having blood clots with the COVID, the oral contraceptive, the recent travel. Um, and so I was kind of keeping an eye on monitoring all my various symptoms and things that were popping up. And for me, I actually thought it was a pulled muscle in my leg initially, just with the circumstances. I had walked up to have a meeting with my boss, and you know how sometimes you just like various joints crack and pop and crackle and all of that. I thought I had just popped my ankle like I often do. It hurt a little bit, which was unusual, but not completely. Like I'd had painful ankle pops before. And so I just assumed it was that, but then the pain didn't get better after a couple days. So I ended up going in to see my primary care doctor just because, I was trying to be really on top of things. And she was like, well, yeah, come in, we'll take a look at it. It's probably a pulled muscle. She felt my leg. I didn't have any swelling. I didn't have any redness. I didn't have any, like, it wasn't warm, which are kind of the hallmark signs of a blood clot in the leg. The only thing I had was pain, really. And even my doctor didn't really think it was a blood clot. But she's like, you know what, we'll send you for the imaging just in case, rule it out, be on the safe side. And then, of course, it turned out that it was a clot. Um, so yeah, it was a pretty atypical symptom for me. And if I hadn't been so vigilant about it and knowledgeable myself, I honestly probably would have missed it.
So you mentioned that you screen these clots at your practice. I was wanting to ask how do you do that? Is it a X-ray or a special imaging machine? Yeah.
As a physio, at least in the US where I was working at the time, we don't have
Mm.
access to any of that nice fancy imaging equipment or anything, um, or
Mm-hmm.
or the ability to diagnose within our scope of practice. But anytime somebody would come in with symptoms, we would kind of look at a few various things. So first would be, asking them questions about it, like, what does it feel like? When did it start? What were you doing? Like, what were the risk factors there? So some of those risk factors are recent air travel, immobilization, um, certain medications, and then recent surgery. There's a few other things. There's a proper screening tool that you can use called the Wells prediction criteria for DVTs. Um, but then we would look at it and see, is there any swelling? Is it red? Is it warm? Are they tender to palpation along the deep vein pathways? So essentially, if we poke them along where their veins would run, the deep veins in their leg, is that where it hurts? And is it unilateral? So is it only affecting one leg versus both legs? So if somebody had like cellulitis, which is an infection or inflammation, that often affects both legs a little bit more equally, whereas a blood clot is usually just one leg. So looking at all those different factors and kind of doing a risk assessment to determine if it seems likely that they have a clot and they need to be sent for further imaging and workup,
Mm.
or if it seems unlikely that they would have a clot and would be safe to continue with therapy.
Did the doctor prescribe any anticoagulants or blood thinning to help with the clot in your leg?
Yeah, so I was on an oral anticoagulant medication for 6 months, and then they redid the imaging to check and make sure that the clot was gone before they took me off of it.
Mm. I was going to ask if you got any vaccines prior to or post your infection.
I did, yeah. So um, because I was working in a hospital, I had access to the vaccines fairly early on, and I got 2 doses of the initial Pfizer vaccine, and then I had one follow-up booster by the time I got infected with COVID, and that last booster was about 3 months before my infection. And then since then, I've had 2 additional boosters afterwards. I never had any problems with any of the vaccines. They didn't give me anything more than a
Mm.
sore arm. Even the ones that I got
Mm.
after I had long COVID, they still only, the only issue I had myself was a sore arm. Though I know some people do get flare
Mm.
ups of their symptoms with the vaccine, and obviously some people have been vaccine injured. Um, but for me, that wasn't the case.
So, in terms of the vaccinations, was it I guess, a medical requirement of your practice to get all the shots, including the boosters, or was it more along the lines of just thinking, I'm going to finish the course, yeah.
So the initial ones were highly encouraged for, or required unless you had a, a good reason not to get them, for
Yeah.
working in the hospital where I was working. After those
Mm.
initial ones, it was my decision to get the boosters, because for me it felt like the better option to go ahead and get the boosters than take the risk of getting COVID again without the boosters.
Sure. Okay. It's cool hearing your perspectives on the vaccines. I think I'm somewhat more timid of going and getting any more boosters or anything. Like, I don't really want to touch another vaccine while I'm alive now. But I suppose in hindsight, at the time, I thought it was the best thing for me to do. But right now, I don't know if it was because I am starting to pick up signs that I might have vaccine related injuries. But it is difficult to prove at this stage. But yeah, um, I wanted to touch back onto POTS and dysautonomia, and if you could share a bit about those terms and what they are. Yeah.
Yeah, so dysautonomia is an umbrella term that refers to essentially any dysregulation of the autonomic nervous system. And the autonomic nervous system is the part of your nervous system that kind of takes care of the unconscious or automatic functions of the body. So things like your blood pressure, your heart rate, your breathing, your digestion, your temperature regulation, a bunch of other different things. Um, there are two, well, there's 3 branches of the autonomic nervous system. The sympathetic, which is your fight flight response, the parasympathetic, which is your rest digest recover response, and then the enteric, which is your gut. um, when we're looking at dysautonomia, it can impact all 3 branches, but the ones that we look at most often are that sympathetic and parasympathetic. So the fight flight response versus the rest digest recover response. And both of those can then impact the enteric, which is why a lot of people get a lot of gut symptoms, among other reasons. But when we have dysautonomia, it's usually an imbalance of the parasympathetic and the sympathetic branches of the nervous system. When it comes to POTS and long COVID, what we often see is overactivation of the sympathetic, so too much fight, flight response, um, not enough rest, digest, and not a good balance and ability to transition between the two, because we don't want to like totally shut off one or the other. We need to have a balance and we need to go between the 2 states. Um, And so a lot of people with long COVID have some form of dysautonomia, and postural orthostatic tachycardia syndrome, or POTS, is one of the most common and most well known of those forms of dysautonomia. But some of the other ones that a lot of people will experience are orthostatic hypotension, which is where your blood pressure drops when you stand up. Inappropriate sinus tachycardia, which is where your heart rate can just be high all the time, regardless of your body position. Orthostatic intolerance, which would be symptoms are worsened when you're in a more upright position, but it's not necessarily vital signs that are changing. So like you could get a headache, or you could feel dizzy, or you could have some other symptom come on, but it's not related to your heart rate or your blood pressure. There are other types of dysautonomia as well, but those are some of the most common ones. For postural orthostatic tachycardia syndrome, the hallmark symptom is related to the heart rate, and that's where the name of the syndrome comes from. So postural is related to your body position, orthostatic is related to being upright, tachycardia is elevated heart rate, and then a syndrome is a collection of symptoms. So essentially, we have a collection of symptoms where the hallmark sign is that your heart rate goes too high when you stand up. And that's what the name of POTS describes. So what we see is that for individuals with POTS, when they go from being in a recumbent position or lying down, and they go into a more upright position, in particular standing up, we have an exaggerated and sustained elevation of the heart rate. So the heart rate goes high and it stays high. And the threshold for diagnosis is 30 beats per minute for adults, 40 beats per minute for adolescents. So if you're laying down and you take your heart rate, and then you stand up and you take your heart rate multiple times over the course of 10 minutes, or for however long you can stand up until 10 minutes, to get a diagnosis of POTS, your heart rate would need to increase by at least 30 beats per minute when you stand up, and it would need to stay at least 30 beats per minute on at least 2 of those readings within the first 10 minutes of standing up. So if you are somebody who you stand up and your heart rate spikes, but then it recovers and stays stable afterwards, then you may still have some orthostatic intolerance, but you wouldn't necessarily meet POTS criteria. And that's the case for me. Like if I take my resting heart rate laying down, it'll be usually somewhere in the 70s. And then I'll stand up and it'll spike up to the 120s, sometimes even close to 130. But then within a minute or two, it comes back down. And so I have that spike and I get symptomatic, but my heart rate doesn't stay high. For somebody with POTS, their heart rate would stay high. People also get all kinds of other symptoms too, because anytime you have dysautonomia, it can affect anything that the autonomic nervous system touches, which is pretty much everything in your body. So a lot of people get, trouble with temperature regulation, body temperature. They get dizzy and lightheaded. They may feel faint. They may pass out. They may not pass out. Trouble with digestion. They may have blood pooling and other circulatory issues. Troubles with sensation, like pins and needles and prickling feelings and pain. There's a whole lot of other symptoms that can go along with POTS and long COVID dysautonomia beyond just the heart rate issues.
So in terms of the garments, is it just a tight fitting pair of pants or socks, like tighter than normal, or is it a specifically designed compression garment? Yeah. And also, how does that benefit the dysautonomia or the POTS?
So I'm going to go with how it's going to help first, and then I'll talk about the garments themselves. So one of the things that a lot of people with dysautonomia experience is blood pooling, meaning that, and this is one of the drivers behind the heart rate rise in POTS, when you go into a more upright position, normally your blood vessels should constrict to help keep the blood going back up towards the heart and towards the head. for people who have dysautonomia, oftentimes those blood vessels don't constrict properly. And so the blood pools down with gravity and it can kind of get almost stuck in your lower body and your legs. And when we wear compression, it helps to support the circulation by kind of providing an external squeeze onto those blood vessels. So they're not squeezing properly on their own, so we're going to give them some help with the compression. And that in turn helps bring more blood back up towards the heart and more blood back up towards the brain, and it will improve symptoms. When we're looking at what type of compression to wear, compression garments are actually a specific type of garment. They're not just something that's really tight. So if you have, your old pair of yoga pants and they're just really snug, they're not actually going to be providing you any compression in the way that we would need to get this benefit. So you do actually need to get specifically designed compression garments to wear. And the number one thing that you want to be looking for, if possible, is what's called graduated compression. And what this means is that the level of compression changes over the length of the garment, and that is to help with blood circulation. So if we, for example, look at a pair of socks, compression socks, we want the compression to be the tightest at the bottom, so usually like right down around the ankle. And then for the compression to get a little bit less as we go up the calf towards the knee, and if they're full length compression socks all the way up into the thigh. And what that does is it helps support the blood pressure by having the tightest compression at the bottom and then a little less as you go up. So it almost acts like a little bit of a squeezing motion to bring that blood flow back up. Whereas without the compression, it would all just go down with gravity. So you want to be looking for graduated compression, and you do want to look for something that is actually designed as a compression garment, because the type of support and the amount of support it gives you is going to be totally different than a normal piece of clothing that's tight.
So there's no risk for like your feet going numb or reducing blood flow to your limbs?
So if you have compression that is too tight, it could be problematic. Now, for the majority of people, too tight is going to be something you would not be able to get without a doctor's prescription. We're talking about, commercially available compression garments for the most part here, and it's hard to get something that is, if you get something that's the right size for you, then it would be hard for it to be too tight to that degree. But that being said, if you're considering wearing compression and you've never worn it before, I would definitely talk to your medical provider about it before you start, because there are some contraindications to wearing compression for some people. And then when you do start wearing it, I often recommend for people to start with a slightly lighter grade of compression. So there's different grades of compression, and different countries do this in different ways. So like in Europe, they have I think they grade them like grade 1, grade 2, grade 3 type of thing. In the US, they rate them based on the amount of compression measured in millimeters of mercury. And then there's a cutoff at which point they're considered medical grade compression, which is a higher level of compression. You would often need a doctor's prescription to get those. But generally, when you're first starting out, I would recommend for people to start with a slightly lighter level of compression just to see how they're tolerating it, because a higher level of compression, at least initially, can be uncomfortable and also really hard to put on. So it's better to start lighter and then go tighter than to start with too much and then not be able to wear it.
And you're not practicing physio currently right now, but I'm guessing most of your work is online at the moment?
Yeah, so I was working as a physiotherapist for 8 years in the US. And I actually worked with POTS since 2015. So POTS can occur from other things besides long COVID, and we can come back to that if you want to. But I am not working as a physiotherapist in a clinic anymore. And there's a couple different kind of reasons for that. But what I do now is I do virtual coaching for individuals with POTS and long COVID and other dysautonomias. And so everything that I do is fully online. And there's a couple of reasons why this is beneficial. Um, Number one is that it allows me to work with people anywhere in the world as a coach rather than as a physiotherapist. And as you've probably experienced or heard from other people that you've talked with, finding local providers who are long COVID and dysautonomia knowledgeable and aware is really challenging. Like there's just not that many of them. And if you do find one, it's often hard to get appointments, or maybe you have to travel a long distance to see them. So it's not a particularly feasible means of rehabilitation for a lot of people. The other challenge is that these are energy limiting conditions. And so getting out to an appointment in a physical location can often be really challenging. And it may be the activity that is overexerting you. And so you spend all of your energy just getting to and from these appointments. And then you're not able to actually really participate in the therapy, or getting to and from the therapy causes you to crash. So then you're not getting any benefit from the therapy. And so when I'm able to work with people virtually, we cut out all of that travel time and energy. And so now we can really focus in on what are the things that you really need to be working on, and how can we manage your energy without using all of it just for you to get to a point where you can speak with me and see me in a clinic. Um, the other benefit is that as a coach, I can be more flexible in working with people where they are on what they really need at that time, and not dictated by what their insurance might cover. And again, this is something that's different country to country, but certainly in the US where I was working, the insurance dictated a lot of what type of care and how much of it people could receive. So the insurance would dictate how many times you could go to physiotherapy per year. They would dictate what types of care you could have because they wouldn't cover certain things. And so working virtually as a coach, I can work on what people need that's going to really help them get better and focus on their goals and their needs, rather than having to work within a model that the insurance is dictating a lot of that. And like I said, that's different country to country, but that had been my experience in the US. I was just going to say the third piece of it was that it was something that was a better situation for me as an individual living with long COVID, that working in a hospital-based clinic, and the clinic where I was working, I was actually the program director. So I was in charge of a lot of different things, and it was great. I loved it, but it was a lot. And once I developed long COVID, I realized that it probably wasn't sustainable for me. And so transitioning into a job where I can work from home, everything I do is virtual. I have a little bit more freedom of mobility, which allowed me to move to a different country and be closer to some family. Um, it was a better setup for me with my own health as well. So that was kind of like the third main piece of how I transitioned from my clinic work into what I'm doing now.
And just to clarify, are you still battling long COVID?
Yeah, I would say I'm definitely better than I was, but I'm not back to what I was before, and I don't know that I necessarily will get back to 100% of that, and that's okay. But yeah, I'm still very much actively living with long COVID and managing it. I'm able to do all the things that I need and want to do on a daily basis, but I do still have to be mindful of what I do and how much I do. And, I can't just go and go for an 8 hour hike like I used to be able to, and I'm not going to go run a half marathon like I used to. So I do definitely still have to manage things on a daily basis.
Sure. And Naomi, tell us about your page. It's called All About the Pace, that pace?
It's called It's All About That Pace, with
It's all
underscores.
about the face.
It was a play on there's a pop song from, I don't know, maybe like 10 years ago called It's All About That Bass. But
Megan
so
Trainor, yes.
yeah, Megan Trainor. So my page is kind of a combination of providing resources and information and community for people who are living with POTS and long COVID and other energy limiting conditions. It provides information and resources and support in that way, but it's also a way for people to be able to connect with me if they are looking to get some help. So it's a way for people to connect with me if they want to have some coaching or if they want to work with somebody on learning better management strategies. I do individual coaching one-on-one, and I also have a self-management course program that also has a peer community part of it. So my page is a way for people to connect with me there as well, and for me to
Amazing.
connect with people as well.
Yeah, so we connected on Instagram, which is awesome. Just love connecting with people who are in the same boat as you, going through similar struggles with this very new disease. And yeah, I was going to ask, are there any other supplements or medications you could recommend to go along with your treatment? Yeah.
Yeah, so for myself personally, I haven't gone the route of adding in a bunch of medications or supplements. As far as medications go, I haven't had any symptoms that have really warranted it. I did have a lot more tachycardia, high heart rates early on, and my doctor and I did very briefly talk about trying a medication for it, but with where I was and what I knew and where other things were like my low blood pressure, we opted not to do it. And my heart rate has improved overall since then. Um, but I don't have any other symptoms that I have felt kind of warranted medications. As far as, or my doctor didn't feel that way either. I should put that caveat in there. As far as supplements go, I also haven't gone that route in part because, again, I haven't necessarily felt like there was like one big thing that I wanted to try a specific supplement for. And the other piece is, as people who've gone the route with supplements are aware, it can get very expensive very quickly. Um, and for me,
Mm,
if I'm going to do something like that, I'm going to make sure that I'm using like the high quality stuff and all of that, and I just don't have the budget to
mm,
go that route with things right now. I will say the
mm,
one thing that I have added in is a magnesium complex, but that's not specifically related to my long COVID. It was more related to menstrual health, but I do think that it has probably helped with long COVID just because it does really help with sleep and nervous system support, and so I think that that has been beneficial. But
mm.
for me personally, that's pretty much all I've done. As far as what I would recommend, I don't typically recommend anything because it's not really within my area of expertise to make any recommendations there.
Yeah.
So if somebody is taking supplements, I'll definitely take that into consideration with as I'm working with them. But I don't typically make any specific recommendations for additional supplements because, like I said, it's not my area of expertise.
Mm. And just in closing, I'd love to ask you what you would say to someone to encourage them who is battling with long COVID or a similar chronic disease.
Yeah, so everybody's going to be at a different point in their journey. So what's encouraging to each individual person is likely to be a little bit different. But I think overall, the things that I would say is, where you are now doesn't need to be where you end up, meaning there are a lot of different things out there that you can do to help yourself feel better. And if the things that you've been trying so far aren't working, it's likely that you just haven't found the right combination of things yet, or it hasn't been long enough, like you haven't had enough time for things to work. Um, and so, you know, be accepting of where you are, meaning don't beat yourself up for still having symptoms, or, if you have a crash, don't blame yourself for it. Learn from it. It's okay to accept where you are now and make the most of where you are, and, try to enjoy your life and do things that are fulfilling for you. But you can also still, with that, aspire to more. So accept where you are now and still have goals for improvement from there. I think that's something that makes a big difference to a lot of people in their recovery. If you're always kind of beating yourself down about where you are now, it's very hard for your nervous system and your body to recover and make progress. And when you're able to kind of take a step back and say, you know what, I'm here now. That's okay. I'm going to make the most of where I am now. And I still have these goals that I'm going to keep working towards as well. And that's, I think, something that can be really powerful for a lot of people. And I know we didn't really touch on pacing a whole lot, but learning how to pace yourself can be one of the most empowering things for a lot of people, because it gives you a lot of control over what you're able to do and how your body responds. A lot of people, when they get told, oh, just go pace yourself, the immediate feeling is like, I just have to do less and my life is going to get smaller and I'm not going to be able to do anything anymore. But the reality is that pacing gives you stability. And when you have stability, you have predictability. And when you have all that, your nervous system can start to recover. And then you can start to actually add things back in again and know what's causing symptoms and what's not. And when you have that stability, that's when you can actually start to expand again. So pacing is actually about learning how to do more. It's the first step of being able to do more. And so if you are somebody who is struggling with one of these conditions and you haven't ever learned how to pace yourself, that's something that I would go and learn how to do, because it's going to be really empowering for you to have those tools to implement for yourself to make yourself feel better. And definitely find somebody who can help you learn that, because it's really hard to learn on your own.
So just for the listeners that might not know what pacing is, it's basically, as I understand it, learning to manage your energy output throughout the day, conserving energy and just managing like the amount of energy you've spent, right? Is that correct?
Yeah. Then the other big piece of pacing, though, is learning about restorative activities. So there are actually things that you can do that can give you energy, um, either in addition to or instead of sleep, because a lot of people do have non-restorative sleep. There are things that you can do to rest better. And when you rest better, that can improve your energy capacity as well. And one last thing I forgot to say about the compression
Hmm.
actually is that
Hmm.
in addition to improving circulation and preventing blood pooling, the compression can help with energy management, because it makes it so that your body doesn't have to work as hard to get the blood back up to your heart. So it can actually be an energy boosting thing as well for a lot of people.
Amazing. Thank you so much, Naomi. Thank you for your time this evening, for taking time out of your evening to come and talk to me and hopefully encourage some people on the channel. I've learned a lot about the compression garments, the POTS, the dysautonomia, and I'm sure a lot of the listeners will find that information very helpful. Yeah, thanks again, Naomi.
Thank you, you too.